Donor harvest, intraoperative direct visualization and palpation of the heart, previous scars, previous trauma in the heart, coronary artery calcification should be ruled out. Hemodynamic instability during harvesting can happen, which should not happen. So it may require invasive blood pressure monitor, some low dose of vasoactive medications. You don't want to give a very high dose inotrope, very high dose of vasoactive medication during harvesting. Ischemic time is important. Ischemic time is defined as when you clamp the donor heart to clamp release in the recipient heart after implantation. It should be between 4 to 6 hours. When you see a recipient, now coming to recipient care, preoperative visit, it just happened just before surgery most of the time. Patients are full stomach. Patient has history of previous heart surgery. Most often they had CABG, left ventricular assist device implantation, epicardial lead implantation, other operations in the heart. Sometimes they have valve surgeries. Confirm the symptoms. Improvement possible in viral cardiomyopathies. You see a patient after 6 months of listing, that patient may have an improved ejection fraction. So you may want to rule out there is a natural improvement before taking the patient to the OR. So you may want to put the point of care ultrasound and see the heart function, confirm the patient's ejection fraction is still low. The drugs and anticoagulants should be managed appropriately. If you have milrinone home medication or home infusion, you want to continue it till you go on bypass. Patients are usually on anticoagulants, and I will go through how you manage them. Preoperative preparations, all the emergency labs should be sent as soon as the patient arrives, and results should be checked. You want to type and cross looking for antibodies and CME-free products in patients who lack antibodies. Arrange fresh frozen plasma, and recent days it's prothrombin complex concentrate for patient receiving Coumadin. You may want to place IV on arterial lines before going to sleep. Wait for the call from the organ procurement team to go to the OR. You may want to coordinate well with the procurement team. Consider transport distance and previous surgery. If you have a transport distance which is longer, you may want to take that into consideration when you induce patients. If a patient has previous surgery, your dissection into the cannulation may take time, so you may want to take that into consideration too and plan accordingly. The AI patients usually had AICD. You may want to inactivate so that the cautery doesn't interfere with the cardiac function. Pre-medication, we usually give H1 and H2 blockers. You may want to give acetaminophen oral if the patient has pain. Methylprednisone 1 gram IV, we usually give as a pre-medication for immunosuppressive drugs, especially if you are using Camphath for pre-medication. For reaction prevention, usually sedation is withheld. Camphath is nothing but a recombinant DNA-derived humanized monoclonal antibody against the cell surface glycoprotein. It's an immunosuppressant. Simulect, which is basileximab, is another immunosuppressant we commonly use, does not require H1, H2 blocker or steroid premedication. It can be given without premedication. Induction of anesthesia, standard ASA monitor, invasive arterial blood pressure monitoring before induction of anesthesia. Because of full stomach, these patients require rapid sequence induction. Usually I induce these patients with etomidate and succinylcholine. The practice vary. You don't want to use a high dose propofol bolus. Vitamin K is usually administered for patients who are on Coumadin, so that it takes its effect within 6 to 8 hours. The postoperatively you sustain the anticoagulant effect, sustain the procoagulant effect so that the patient doesn't bleed in the late postoperative period. Antibiotics appropriately should be given, and Camphath or Simulect, which are common immunosuppressants, are used. practices vary. Some institutions don't give it intraoperatively, some institutions give intraoperatively. So you may want to be aware of its reactions.